Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Matthew Hornbeck, principal of Hampstead Hill Academy, a K-8 public school in Baltimore City, speaks to Dr. Josh Sharfstein about the challenges of virtual learning, the fears of teachers and staff, and plans to open up in the coming weeks. Might the vaccine make a difference in giving the confidence to reopen schools? Principal Hornbeck thinks yes. Let's listen.
Thank you very much, Principal Hornbeck, for joining me again on the podcast. How are things going at Hampstead Hill Academy?
Thank you for having me, Dr. Sharfstein. It's a pleasure to talk with you again. Things are going well. We're very hopeful about the resumption of in-person instruction for all students at some point this school year, which is very exciting.
So right now, how many children do you have coming to school?
There's no one in school right now. We have a number of staff working from the building and plans to start bringing students back in the middle of February for Student Learning Center, and then in March for in-person instruction.
How has the remote learning been going for all the students in your K-8 school?
So our 852 students are on the whole doing pretty well. We have about 96% attendance each day. But we do have, and many students are earning very strong grades. Unfortunately, just like all over the country and the world, the effects of remote learning are devastating for dozens and dozens of our students. Poor connection, very limited space at home to have a dedicated school space, and we have much lower grades with a lot of students. So, and then you can't stare at a screen for as many hours as you can be in person at school. It just doesn't work that way. That's not the way human beings are built. So I think that once we get some in-person instruction going, it's going to be very good for our kids.
Is there a way to reach out to those students and bring them back first?
Yes, we have all of our 5th through 8th graders who received low grades first semester will be invited back in mid-February for an HHA-specific or HHA-only Student Learning Center. And they'll be working remotely from school for a few weeks until their grade is invited back. And even when their grade is invited back for in-person instruction, they'll be able to spend the rest of the day, because it'll be a fraction of the day when we have in-person, they'll be able to spend the rest of the day at HHA continuing to work virtually.
I remember when we talked back in the spring, just the abruptness of the shift to online learning was so difficult. What do you think has made the difference in helping at least the majority of the students do okay online?
Well, the talented staff we have is just making all of this possible. So we have about 95 people working with 852 kids, a teaching faculty of about 60, and they are just extraordinary. So it's their live synchronous work and relationships with students that are even making what we're doing now possible and pulling it off with some degree of quality. But there are holes in what we're doing, and we can't wait to get back.
So let's talk about the staff. How do they feel about going back? It's been a controversial issue in many public school systems.
It has, and it's been very difficult at the school level to figure everything out. And I'm glad that the new administration, that the Biden-Harris administration, and that the governor and the school district and the health department all seem to be kind of aligning and getting the same message out to schools. When I did about 70 individual mid-year conferences, staff are very excited to return as long as they have the opportunity to get vaccinated. And we have about 50% of our staff who will have had their first shot within about 10 days from now. And that is very, very exciting to staff. And I think that, for us too, just on December 23rd, this was in the newspaper, Dan Rodricks did a very good piece on it. We lost one of our parents, Dr. Amanda Zivik, and it was just devastating to our school community. Her children attend Hampstead Hill for a number of years, and we were very shaken by that. And so, at this point, everyone knows somebody who's had COVID, and many people know someone who's been in the hospital, and a few have experienced the unimaginable in terms of a loss of a loved one. And so, when we're taking a couple of weeks longer than the school district to resume in-person instruction. We have some flexibility because we're a conversion charter school, and we're going to try to sort of see how the labor management challenges at the state and the local level play out, give the couple of weeks for the metrics to, I think, hopefully continue to go in the right direction. Positivity rate in the city today is only 5.5%, which is really mildly encouraging, and give our staff a little bit more time to get vaccinated. But we are excited and ready to go.
So it sounds like with the tragedy of a parent dying of COVID, at the same time, you see the challenge of some of your students really not able to do well at all online. You see both sides of what's turned into a pretty contentious debate nationally.
Yeah, yes. I mean, in the Times this morning, they're talking about Las Vegas opening in order to mitigate some just tragic loss of students in Clark County. And I think that the mental health and sort of rampant depression and anxiety is definitely being felt by students of all ages. And so, we know that it's better to be in person, but we definitely want to try to put everything into place that will make our faculty and parents and students safe and bring them back in a sensible way. So we're working on it, but we definitely, it's kind of where the rubber meets the road in some ways at the school level is how does all this policy, how does healthcare policy and education policy and how do academics and social emotional learning all come together, and how do physical plants, in our case, we have a decent physical plant. The building's 32 years old, which is young in the city. And how do physical plants play in the reopening of schools? And it's not easy for principals to figure out. I've been talking to my colleagues, and they are swimming in details.
So in talking to your staff about the vaccine, how is that going?
So there are three categories of people that you could think about. One is, give me the vaccine the second I can get it. I need the appointments. I need it now. The other is, I want to be a week or 10 days behind the first people to get the vaccine that I personally know. I want to see how side effects look. And once I got my first shot, I sent out an email with a picture of me getting the shot. And I had very mild symptoms and just a little bit of soreness at the site, just basically nothing. And there's a group of people who are they don't trust the vaccine, and they don't trust vaccines in general, and just the history in our country of mistreating people of color when it comes to experimenting with vaccines is very much at the forefront of the minds of some of our staff. And so they're worried about that. But overall, even people who are concerned about it are thinking very hard about it and leaning towards eventually getting the vaccine.
And it sounds like they see the vaccine as a good protection against coming back to the classroom. And it's pretty clear to them that with the vaccine, they're ready to go back. Is that what you hear?
Yes, that's correct. I'll give you an interesting rationale, though, for getting it. I've got a couple of staff who never get the flu shot, and they've never gotten the flu. And so they don't get the flu shot every year. And they said, I'm going to get the vaccine, even though I don't want to, but I'm going to get it because I want to remove myself from the variable in a student getting it and passing it on to someone at home. And so one of their concerns is the well-being of, a primary concern of our staff is the well-being of their students and their students' families. And they don't want to be part of that possible mix, even though the chances, and we know from studies around the world, the prevalence in schools of the virus is low. They just don't want to be a variable in that possibility.
So I want to go back to your comment about you're where the rubber meets the road. You've got to balance these different conflicting demands. What do you say to parents who might call you and say, my kid really needs to go back to school. Why can't you open earlier? And, there is obviously pressure from a lot of political leaders to do that. And then also, what do you say if you hear people say, well, even with the vaccine, I don't know if I'm going to be completely safe and maybe we should just wait for this whole thing to blow over. So we certainly have heard that out there. So, how do you as the leader of a school try to navigate these, difficult crosswinds?
So pretty much the way you would guess, kind of just speaking directly and honestly about the where we are at each moment. I'm having weekly meetings with about 70 parents on Zoom. And I do a weekly robocall to everybody in our school community, about 2,000 people, and just keeping everybody up to date. We have begun to say in these last weeks, we will be returning to in-person this year. But as is the case all over, every parent has the option as to whether or not to send their child. But then, Josh, the discussion turns into, well, can I keep what I'm doing right now in terms of remote learning? Because many people are thriving and like the schedule. And the answer, unfortunately, is no, that it's likely that the online experience will be diminished once we have to do a hybrid setting where the teacher is working with students in a live in-person setting and at the same time synchronously with students working online. And so the schedules will be different and it's going to be a learning curve for us.
So you're going to have to reinvent education again at Hampstead Hill Academy.
Yeah, we think if reinventing it in March and then again in August wasn't enough. And so we think one more time and hopefully this year we'll finally conclude. This summer is going to be a big deal in terms of mitigation of loss due to COVID. And we've dedicated budget to trying to recruit up to 20 of our staff to work for 10 weeks instead of we normally spend 5 weeks, and instead of up to 4 hours a day, up to 6 hours a day on reading and math remediation to try to get us ready. We continue to try to look 8 months out, a year and a half out.
So you'll be inviting a bunch of your students back for the summer too?
A couple of hundred, yes.
Got it. Well, I wish you a swift vaccination process, a safe return to school, and a really strong recovery for the education of the students at Hampstead Hill.
And thank you and all of the public health officials for taking such good care of all of us and doing the work that's going to make life seem normal eventually. Thank you so much.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.